Our hospital is located in South Los Angeles. It's an area of the county with traditionally a shortage of healthcare providers, underserved community with respect to access to care. Our emergency department typically sees over 110,000 visits annually per year, which is a really large number of emergency department visits for a hospital that only has 131 beds. When International Medical Corps started talking with us about ways and possibilities for help, we started to see some of the equipment that they could bring to the table to help us in preparation to actually care for patients. That's when things really change for us. We're concerned about the severity of illness from coronavirus amongst a community that has higher rates of diabetes, renal failure, dialysis, dependency, and other chronic conditions like heart conditions and COPD than most other areas in Los Angeles County. We started seeing our first cases about 3 weeks ago, but they were not very frequent. 2 weeks ago, we started getting multiple patients per day. We're definitely experiencing pretty significant volume of patients with COVID-19 on the inpatient side. The emergency department has been doing pretty well because of a lot of early action that was taken 3 weeks ago, which IMC had a ton to do with, as our ability to handle COVID-19 patients more appropriately in a safe manner. That kind of early intervention has really helped us stay ahead of it. We have had processes for 2-3 years now where we're utilizing space outside of our emergency department to handle a large surge volume of patients. But the tents that we've had have been relatively small. The tent that we have now from IMC is really large. It allows us to really compartmentalize care for COVID positive patients or potential COVID patients. When patients arrive to the emergency department seeking care, we're able to separate patients out that we think have a higher likelihood of being COVID-19 positive, and then move them into a tent that has adequate ventilation and adequate size to keep patients separated from each other, and yet keep them also separated from patients coming to the emergency department for other reasons unrelated to COVID-19. It's really been a cornerstone of our ability to respond to the current crisis and keep everybody safe and separated as much as we can. I just want to thank the International Medical Corps for really stepping up and helping us. I was amazed at not only the willingness to help us in this area, but in other areas with significant amounts of equipment, from beds, like physical beds for us to use throughout the hospital to try to double our inpatient capacity. And then also the speed and completeness in which the gift was brought on site. The tent was up and operational in less than a 24-hour period. It really has allowed us to stay ahead of this. And I think it's really going a long way to help us take care of folks here.